Lytgobi tablets is used to treat a certain type of cancer, bile duct cancer. Active ingredient Futibatinib. Futibatinib works by slowing or stopping the growth of cancer cells. It works by a class of drugs known as kinase inhibitors. How to use? Lytgobi is applied as tablets for oral administration. The recommended dosage of Lytgobi is 20 mg. 5 4 mg tablets taken orally once daily until disease progression or unacceptable toxicity occurs. Take Lytgobi with or without food at approximately the same time each day. Swallow the tablets whole. Do not crush, chew, split, or dissolve tablets. If the patient misses a dose of Lytgobi for more than 12 hours or if vomiting occurs, resume dosing with the next scheduled dose. Contraindications. Before you take Lytgobi, tell your healthcare provider about all of your medical conditions, including if you have vision or eye problems, are pregnant or plan to become pregnant. Lytgobi can harm your unborn baby or cause loss of your pregnancy, miscarriage. You should not become pregnant during treatment with Lytgobi. Precautions. Before taking Futibatinib, tell a doctor or pharmacist if you are allergic to it or if you have any other allergies. This product may contain inactive ingredients which can cause allergic reactions or other problems. Talk to a pharmacist for more details. Before using this medication, tell doctor or pharmacist your medical history, especially of eye disorders, high level of phosphate in the blood. Before having surgery, tell doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Side effects: dry eyes, weight loss, dry mouth, changes in taste, nausea, vomiting, diarrhea, constipation, stomach, abdominal pain, tiredness, weakness, or dry skin may occur. If any of these effects last or get worse, tell doctor or pharmacist promptly. Pain or sores in the mouth and throat may occur. Brush your teeth carefully, gently, avoid using mouthwash that contains alcohol, and rinse your mouth often with cold water mixed with baking soda or salt. It may also be best to eat soft, moist foods. Temporary hair loss may occur. Normal hair growth should return after treatment has ended. People using this medication may have serious side effects. However, you have been prescribed this drug because your doctor has doubts that the benefit is greater than the risk of side effects. Carefully monitoring by a doctor may decrease your risk.